We're now going to transition to our next presidential guest lecturer, and we've heard sprinkled through this conference that we think stem cells are an interesting potential treatment. So our next presidential lecturer is Dr. Timothy Caulfield. He's a Canadian Research Chair in Health Law and Policy and a professor in the Faculty of Law and the School of Public Health at the University of Alberta. He's a fellow of the Trudeau Foundation and has been the research director of the university's Health Law Institute since 1993. He's a fellow of the Royal Society of Canada and the Canadian Academy of Health Sciences. He's a principal investigator for a number of large interdisciplinary projects that explore the ethical, legal, and health policy issues, and his area of particular interest and focus is stem cell research. I welcome you to the podium, Tim.
Well, good morning. It's a real honor and pleasure to be here and to have the opportunity to give this lecture. And wow, what a fantastic morning already. You guys know how to put on a conference. I mean, it's great. Fantastic lecture, fantastic award. I'm going to speak about something I feel that is a little bit different from what you've heard about already. It's something I feel very passionate about, and that is the ethics and the challenges around stem cell research generally. But what I want to talk about today is the phenomenon of stem cell tourism. I'm assuming almost everyone in the room has heard at least this phrase. Am I right? Yeah? I mean, it's very common. It's becoming more common, scientific and I guess clinical trend. And I want to talk about today what can be done and basically map out what's going on. So what I'm going to do is that I'm going to talk a little bit about what is this thing, stem cell tourism, talk about the problem associated with the potential harms, but I also want to explore what some of the drivers are, what's creating this phenomenon, because I think that's important. Part of this is going to be a story about science hype, because I also think that what's happening with stem cell tourism is playing out in other realms, genomics, neuroscience, nanotechnology. We have this phenomenon of science hype that has this being leveraged, as I will argue later, to sell unproven therapies. Now, I have no conflicts of interest to disclose, but I do have a very big disclaimer. I'm going to sound like I'm hammering on stem cell research, and I'm not. I'm a believer. I've been associated with stem cell research really throughout my career. I think this is a phenomenally exciting area, as you've already heard, I think, over the last couple of days, and even heard a little bit this morning. So I'm a true believer, and I have had the great opportunity to work with stem cell researchers all over the world, and I'm very involved with the ISSCR, the International Society for Stem Cell Research. So I am a believer. So that's my qualification. But that aside, everyone has to realize there has been a huge amount of hype associated with stem cell research. It's really incredible. In fact, our research team has mapped this right from the beginning. It's almost like a cultural phenomenon, right? When you say stem cell research, I think in the general public, it evokes images of excitement, of cutting edge, yes, controversial, but huge potential. So you have these kinds of ridiculous statements. This was at the bottom there, that quote was from a Canadian billionaire, and he's funding some stem cell research in the Bahamas, I believe. This is huge. It's a game changer. It could eliminate disease, immortality, et cetera, right? So you have these kinds of images everywhere. In fact, I call this science-ploitation. This is taking a genuinely, legitimately exciting area of science, stem cells, genetics, and selling bogus products, right? Here we got anti-aging technology. In fact, we just are finishing up a study on anti-aging and cosmetics in this area. Here we have, it's everywhere in beauty products. You probably have seen this, right? It just washes over you now, right? This idea that stem cells are in jars. In fact, I mean, you guys didn't know that. The stem cell researchers in the audience have been working hard to isolate stem cells, and you can actually buy them. So we have, the popular culture is, again, we're watching this evolution. It went from being cutting edge to now it's just part of popular culture, right? The efficacy is assumed. You guys notice that? And now that I'm telling you this, when you look through Vogue magazine or whatever, you'll see this playing out. Here's one of my favorite athletes, Peyton Manning. As people in this room, many people in this room probably know, he had a neck injury, and allegedly, it's very unclear, and I tried to tease this out, went to Germany to get some kind of stem cell therapy for his neck, and the sports media portrayed this as completely efficacious. There was very little sort of critical analysis of what went on, and he's held up as a poster child. Left to the brutal American science, Manning would probably be carrying a clipboard now instead of making it all the way to the Super Bowl. So they have this sort of normalization of stem cells as ready for the clinic, ethically taken, as I said, efficacy taken for granted. More examples, Toronto Blue Jay pitcher, he's been able to improve his game as a result of stem cell treatment therapy, no critical analysis. Here we have an individual showing up on one of Oprah's shows, or Dr. Oz's shows, talking about stem cell orthopedics. Again, very exciting area, some very interesting research going on, some very interesting clinical research going on. Is it ready for Oprah? Not sure. Here we have Dr. Oz himself. It all ends with Dr. Oz talking about stem cell facelifts, and et cetera, right? So we have this out there. And why am I bringing this up? It seems trivial, it seems frivolous, but it's very, very important because it creates the cultural landscape, it creates the language, it creates the environment where unproven therapies can be sold. And they're even being sold for weight loss now. It just does not end. I don't know how that would work. And then, of course, we have Kim Kardashian using her vegan stem cell, I'm sure GMO-free and gluten-free stem cell facial. Okay, so that is the phenomenon. As I said, we have that kind of cultural background, but it is a real problem. In fact, we did this study not that long ago. In fact, some people in this room might have been part of this study, where we did a survey of first authors and last authors on leading stem cell articles, including ethical and legal journals. Primarily biomedical, but also ethical and legal. And we asked them basically, what are the big issues in the area of stem cell research, which has got to be one of the most controversial areas of science in the last 50 years, right? So we asked them, what are the big issues? And all those ones that kind of sparked the original controversy, embryonic stem cell research, cloning, somatic cell nuclear transfer, those kinds of things they're diminishing as a source of concern. And no surprise, probably to people in this room, what's emerging as the big issues are all the ones associated with translation, right? Getting to the clinic. So we're talking, people are concerned about patents. They're concerned about consent processes and who owns these tissues. All of those things, and the regulatory process, also a big issue and something we're exploring. But number one was the marketing of unproven stem cell therapy. So for the stem cell research community, they view this as the biggest issue. Okay, so what is the problem? What's going on? I know everyone in this room probably has a sense of it, but what's going on? So if you're a patient, you're a parent, and you Google stem cell therapy, you are met with a barrage of websites that look entirely legitimate. They look exciting, they look cutting edge, and they're all over the world. And they are offering services for everything that you can possibly think of. As I said, it's really important to highlight these clinics often look tremendously legitimate. What kind of services are offering? So they're offering stem cell therapies for so many things that they have to put them in alphabetical order, right? Whoops. They have, I don't know how to operate this because I'm not a clinical researcher. Okay, so they offer services for ALS, for Alzheimer's, anti-aging, that's everywhere, of course, right? Autism is a big one, I found it. And CP, you get the idea. They offer all of those things. Here's a clinic that is in Ukraine where, again, they offer therapies for oncology. I did not know that was a disease. Diabetes, nervous system problems. Again, we have aging problems. You get the idea for absolutely everything you can think of. Here's some more recent ones. autism is a very, very common one that infuriates me. It's such a complicated disease, obviously, right? We don't even know what's going on. Do we have a stem cell therapy for this right now that's ready for the clinic? Of course not. Parkinson's, diabetes, also a very common one. CP, also a very common treatment that they allegedly have that's ready for the clinic. And there are an endless stream of YouTube clips of patient testimonials. Here's one from India talking about how a stem cell treatment improved CP in this child. And it's really heartbreaking, actually, when you look at these. So in 2008, we published this piece where our team kind of pretended we were patients, and we went to these websites to get a sense of what is the face of of the websites, how are these being represented, and we wanted to get a sense of what's being promised, how are they being represented, because one could argue that if patients knew all the facts and they still wanted to take this leap, from a perspective of autonomy, they should go for it. So that was really what drove this, right? Are they being given the facts? So we wanted to get a sense of that. So we went to these websites, and what did we find? It's going to be no surprise. We found that the therapies are offered as efficacious, routine, and without risk. In addition to that, this was an interdisciplinary team, we used technology assessment experts, Tanya and Dave Menon, and they went through what was being offered and looked at what the literature actually said in sort of a technology assessment, using a technology assessment approach, and no surprise, the claims were not supported at all by the literature. So that was in 2008. Is it getting any better? Because there has been a lot of noise about stem cell tourism, people complaining about it, people trying to take policy steps to make it better. Is it getting any better? Well, our hypothesis was, we did another study, we redid the last one, was that the clinics were going to start reframing their work as experimental, right, and not efficacious, but as experimental. That was our hypothesis. We were wrong. It has not gotten any better. In fact, the clinics are saying it's even, are saying that it is just as efficacious, in fact, a little bit more than they were in 2008, and they really haven't moderated their language at all. In addition to that, we found that the clinics, even if you can shut them down, they move around. They're very, very hard to deal with. So it isn't getting any better. We have this problem. What is the size of the stem cell tourism phenomenon? How big a problem is this? I get asked this question all the time. Well, it's really, really hard to figure that out because it is largely an internet-based industry, right? So to get a sense of how many patients are going over there and the number of services that are being offered, very, very difficult. But people have speculated. My colleague, Doug Sipp, one of the leaders in this area, he puts the market value at $1 billion. Other people have put it even higher than that. My colleague, Edna Einstedel, she figures there are about 700 clinics around the world. Again, hard to get a sense because it's very fluid, very, very fluid, and sometimes clinics are moving rapidly or representing themselves differently, but that's the estimate that she puts. How many patients are going? Again, very difficult to get a hard number on this. I'm just going to use one example. This is an older example, but I think it's a good, using one of the clinics, data from one of the clinics in China. This clinic has actually shifted its mandate a little bit since this time. But from 2005 to 2009, one clinic claimed they saw 5,000 patients. And that's just for the sort of more serious thing, not the cosmetic services. Now, whether that number is true or not, I'm not sure. A representative from that clinic told me the number was actually higher than that a few years ago. So it's hard to get a sense of how big it is. But just looking at all the available data, it seems very, very large and growing. Where are these clinics located? This was a study that we did. Now, this was a study of media representation, so you have to interpret that pie carefully. So that's the number of media representations, but it still gives you a sense of where these clinics are. China's a big player. Germany, less so now, but it is a player. India, I think, is growing. Mexico, growing. You get the idea where these clinics are. They're all over the world. And by the way, there are some that have connections to the United States and even to Canada. Who are going to these clinics? I think most people will agree with this. Again, same study, so you have to interpret that pie chart carefully. But the United States, Canada, and the UK and Australia seem to be the primary sources of the patients, the ones that are traveling. I actually think that that's changing. I think we're starting to see the whole world get more involved, but our study, we found this. One thing I want to highlight that is interesting is look at the number of patients that are kids, right? A lot. So often it's children that are going to these clinics. So again, we could say, okay, we have this phenomenon that's happening. These treatments are not efficacious. So what? What's the harm? I don't have to probably convince this audience of that, but often this comes up. So first of all, there is real physical harm, right? If you are injecting pluripotent stem cells into an individual, there's a potential for real harm. Now, by the way, I think that often, who knows what they're injecting? It could be saline, who knows what it is, right? But if you're injecting stem cells, there could be real harm, and there's some evidence that that's occurring. There's also been harms associated with the procedures themselves. A baby died in Germany, and there's been other deaths associated with it. You also, again, if you're actually injecting or somehow putting in pluripotent stem cells or stem cells with any kind of potential, you have the potential for side effects. This one's kind of disgusting. This was an individual that was getting the wrinkles, trying to remove the wrinkles, and ended up having bone growing in her eye. Ugh. Another one, a very recent one that maybe some people heard about, a woman from Australia died undergoing stem cell therapy in Russia. Now I have to be careful here. We don't know the stem cell treatment killed her. There was something else that happened that she happened to die in Russia, but this is how it's being portrayed. So there's real physical harm that's happening. In addition to that, and often it's underplayed, is the financial exploitation that happens here. Now in our work, we found the average per procedure to be about $20,000 to $30,000. Other groups, the Hopkins group, saw about $50,000 per procedure. So if you go a couple times to China, you fly there, you stay there, it quickly becomes hundreds of thousands of dollars. The other problem, of course, is in relation to stem cell research itself. I think it has a big impact. It could have a big impact on public trust and the legitimacy of the whole field. You know, scientists are working very hard to get this to the clinic. And when you have entities that are offering this stuff, making it sound like it's already ready, you do have this kind of potential adverse impact on the field itself. And I have sensed that when I've given public lectures on this, and I'll come back to this later, you get the audience is very angry. People in the audience are very, very angry, as if the FDA or Health Canada are withholding efficacious treatments, right? Or the industry is somehow playing it because they want to make more money and they don't want these treatments to be available. I see that anger, and so the whole phenomenon of stem cell tourism, I think builds on this. And there's also some interesting, from my perspective as a law professor, regulatory and clinical issues around clinical trials, which I will return to very briefly later. Okay, so we have this phenomenon that's occurring, and there are real harms associated with it. So how did we get here? Now, there are a lot of reasons, and I don't want to just pick on stem cell research, because as I said, we could look at other areas, but I do want to talk a little bit about the area of hype. Stem cell researchers, and partly because it is such a controversial field, are under tremendous pressure to get to the clinic. They're under tremendous pressure to commercialize their work. They're under tremendous pressure right here in California, right, to make that investment seem worthwhile to the public. Now, I think it is worthwhile, but that pressure, I think, does fuel some of the hype language that we've seen around stem cell research. And that hype language, as I said, can be leveraged by these clinics to market unproven therapies. So that this kind of pressure to translate creates the environment and the expectations that allow stem cell research to thrive. There have been a lot of promises, right, around stem cell research. Headlines like this, right? Stem cells could save your life. It could cure cancer. Stem cells can treat diabetes. Look at that headline, right? There's my buddy Peyton Manning again. is it the new way to get rid of wrinkles? This other one here with it can repair hearts, that was a very early stage clinical trial, and the headline and the reporting and even some of the language coming from the physician researchers made it sound like it was ready. In fact, this is unpublished data, by the way. This research has just been submitted for peer review. So if there's any peer reviewers in the audience, be kind. So what we did is we looked at how is it ready for the clinic, how that is represented in the popular press and popular culture. And we were shocked at the results. We found that almost 70% of the articles said that the stem cell therapy was going to be ready in 5 to 10 years or sooner, right? And now stem cell researchers in the audience know that that's almost impossible, right? If you're at animal studies now, even for an early clinical stage, I mean, that's very unlikely. But 70% of the articles portrayed it that way. We used Geron as the Geron debacle. I shouldn't call it a debacle. The Geron deciding not to move forward with their stem cell clinical trial as the starting point. We went through 5 years back, 5 years forward, and these were the results that we found. Of course, quick aside, in the context of a condition like CP, you see a lot of hype also in this area, people claiming, headlines claiming that it's ready for the clinic. And just to be clear, as you've already heard, very exciting research going on in this area, but it's not ready. It's not ready for the clinic now. Okay, so we have that kind of pop culture representation, and I'm not just blaming the news media, pop culture generally, representations of stem cells as if it's ready, right? So that's the actual treatment itself. Now, another study that we did is we looked at how the newspapers portrayed the clinics themselves, these clinics that are providing unproven treatments. Because if you're a parent, right, you're reading these newspaper articles and you're hearing exciting stuff about stem cell research, and then you see a newspaper article about a clinic you're thinking about going to, or something on the internet, that may have an impact on your decision. So what we decided to do was get a sense of how these clinics are represented in the popular press. And again, the results were remarkable, we think. This was published not that long ago in Nature Biotech. And you can see it's overwhelmingly positive. The green is the negative, but in general, and increasingly so, representations of these clinics in the popular press are positive. There's one little dip here, and that's when the ISSCR, the International Society for Stem Cell Research, put out a report on the dangers of stem cell research, but it quickly bounced back up, as you can see, right? So the overall tone of the article is incredibly positive, so not very much critical analysis. Here's some examples. It's often portrayed, these stories are often portrayed as human interest stories. Someone going to one of these clinics is their last hope, or it's an exciting new therapy that they're raising money to go get. Here's a really good example, and sometimes it's just an inaccurate portrayal. Dakota was blind, but now the 3-year-old can see as if the stem cell therapy cured her. And again, if you're a parent and you're reading that, here's one of my favorite examples. It's an article, our most disturbing examples, is an article from the Toronto Star, which is, I think, Canada's most read newspaper, the Globe and Mail or the Toronto Star. And again, a human interest story. What I find so interesting about this one, or why it's such a good example, is it shows the degree to which these are human interest stories, but also in the article, and we found this, I think it was 37% of the articles did this, in the article, they tell the readership where they can send money to send this person to the clinic. So in other words, the newspaper is helping raise money to send this person to this clinic. Another example of how these stories are portrayed, this one breaks my heart. It was some junior high students in Eastern Canada going on a penny drive to send their blind classmate to China. We have a quote from the child, "I just can't wait to see the sun and the colors and the trees. It's heartbreaking." And that night they were holding a dance to raise the rest of the money. Another example, and I'd like to come back to this one near the end, this is more recent, a story from Australia talking about a mother who's going to Russia to get a controversial form of MS treatment. Now the reason I think this is so fascinating is because it really shows how increasingly difficult this phenomenon is going to become. Because as some people in the room probably know, there is some really interesting, exciting research going on with stem cell research in MS, right? So one could argue, and I'm not supporting this treatment and saying it's ready for prime time, but one could argue that this treatment is a little bit closer to the clinic and shows how, unless we figure out a way to deal with this, it's just going to get more complicated and more difficult to contain. As a result of this story, MS Australia issued a statement saying, look, this is still early days, the data is still unclear, be careful. But as I said, there's some exciting research going on in this area. And if we can't figure out how to deal with this as more and more of these therapies get closer to the clinic, I think we're going to have this phenomenon just accelerate. Okay. I want to get a sense, and I could have drawn on a lot of different research to pass this on. Why are patients going to this clinic? Well, these clinics? Well, it's obvious, right? They want something that works. They're excited about stem cell research. But there's a lot else going on. This is a complicated phenomenon. A colleague of mine who's a linguist, Kristen Rachel, she did an analysis of patient blogs, patients that have gone to these clinics. Now, I understand, and Kristen knows this too, this is not a random sample. And in fact, there's some people have suggested that maybe even the clinics are blogging, right, and pretending to be patients. But despite that, it still gives you a flavor of the dialogue. So why are people going there? No surprises to anyone in this room, the kind of themes that Kristen found. There's no side effects associated with it. China has given us hope, or Russia, or wherever has given us hope, and that's good. Stem cells is exciting. My last hope, I may die anyway. It's our only choice for now. But the one I want to highlight is the one over here, because this touches on what I said before. You hear this again and again, this idea, and this goes to the legitimacy of the field, that somehow our regulatory agencies are failing us, and somehow the scientific community is failing us, and they're complicit, and they're angry that they have to be these pioneers and go to these clinics all over the world when they should have these treatments in the United States and Canada and the UK. These should already be available. So there's that anger, there's that belief that these are available and they're being withheld, are they efficacious and they're being withheld. The other driving force, and this is something that's becoming an increasingly powerful force, is new media, is social media. We just did a study on Twitter, and because of the data that suggests that Twitter and other forms of new media are really certain to drive public opinion in this area. So we did a survey, an analysis of how all these clinics are tweeting, how they're tweeting about their services. No surprise. They're largely represented as advertisements. It's a very unbalanced portrayal of the health risks and the benefits. Only 1.1% mention negative outcomes at all. And remember, these are the ones coming from the clinics. And 35% sort of made a statement about effectiveness, and obviously patient testimonials dominated. Okay, so we have this tremendous, what I think is a tremendous problem and a tremendous challenge. It has real harm, and there are these complicated social forces that are driving it forward. How can we respond? What are the policy actions? Well, there have been policy actions all over the world. We have seen regulators try to stop and actually take action against people that are providing unproven therapies. We've seen the FDA step in and make actually quite bold statements, right? Pretty unequivocal statements about these kinds of clinics, warning people to be very, very careful not to get to seek out these unproven treatments. Very recently, the National Academy of Science put out a similar statement. Entities like the ISSCR, Stem Cell Network in Canada, Stem Cell Australia, on and on and on, have put out statements warning people about this. The ISSCR right now is revisiting their clinical translation guidelines. In fact, I'm involved on that committee, trying to get a sense of how we can get a handle on this. Even the stem cell industry is trying to figure out how to do this. But that obviously, as this headline said, that's a divided community. Some want to really move to the clinic rapidly. Others are worried about how this is going to impact the legitimacy of the whole field. And regulatory entities, and I'll come back to this, are getting involved in actually starting to suspend physicians. But more can be done, I think, and this is something that I hope that we can have a discussion about here. I think healthcare providers play a very, very important role. When a person has made a decision to go to one of these clinics, it's very hard to change their mind. And there's some interesting research about how difficult that is. But there's some sense that primary care physicians, specialists can play an important role. A colleague of mine, Erin Levine, did work on this. And there hasn't been a lot of studies, and Erin's doing more on this right now, where you actually interview the patients that have gone to these clinics. We've actually tried to find some of them, and it's very, very difficult. And often they don't want to speak to you. But Erin has found some of these individuals and did some work on it, and he found that they often do speak to their physician and ask the physician their opinion. And physicians, I think it's fair to say, and we've done, as I'll say in a moment, we've talked to physicians, family physicians in Canada, and say, well, we don't know what to tell patients. So from the patient's perspective, unless it is a don't go, if it's an I don't know or a tacit endorsement, they view it as an endorsement. Follow that? If you say, well, I don't know much about this, this is something you should investigate, patients will view that as an endorsement. And so we put together this document on stem cell tourism for Canadian family physicians. It's very, very short, something that just to sort of arm them with the basics on the issues around stem cell tourism, the state of the science, and how they could talk about this with their patients. And I think something like that would be valuable for any physician. And right now we're working on another document on medical tourism more broadly. In addition to that, this is a paper that just came out. It was just published. And I cut her name off, Amy Zorzechny, one of my former trainees who's now emerged as a superstar, surpassing me. She led this article, and it was a call for professional regulators to get involved. So colleges of physicians and surgeons, associations for nurses, you name it. And why do we do that? Because we did a search of all the clinics and identified who were running the clinics and who were involved, and almost always there was a regulated professional involved. Almost always. So if we can get the regulators to take action regardless of the jurisdiction, and I know that's very difficult, this might be a very powerful tool. At a minimum, it might help to set a norm, right, about how these could, what should happen in this area, and perhaps it could even stem the tide a little bit. In addition to that, we need better information out there. Now, this is work I did with another former trainee, Zubin Master, who's now at Albany. He really led this project, and we wanted to get a sense of what information is available for patients out there in the area of stem cell tourism. And there is some excellent, excellent stuff out there. There really is. But Zubin and our team felt that important stuff was missing. And there's basic science talk, there's talk about what stem cells are, but there's very little discussion of stem cell tourism. And more importantly, and this goes to the trust issue, this goes to how science plays out, the iterative nature of science, that was missing. There isn't a lot of discussion about what the regulatory agencies do, why there are these clinical trials, and how science normally plays out. And we felt that was missing. And there's actually some evidence to support the idea that the more patients or the general public understands about the scientific process, the more likely they are to be critical, to bring critical analysis to their evaluation of existing therapies. So that hopefully you find useful. And we recently produced this patient handbook, taking all the research that we've done on the information that is out there, and hopefully producing something that could be useful to patients and also to clinicians. So I invite you to take a look at this. I hope you find it useful. You can find it on the Health Law Institute website, or you can just nag me, and I'll send it. And I tweeted it, by the way, earlier today, using social media to leverage my sway. Okay, so as I said, I am very, very excited about stem cell research. I am a believer. I think we're going to have exciting things happen in this field. Whether it's regenerative or not, as we heard earlier, I'm not sure. But I do think exciting things are going to happen. More and more clinical trials good clinical trials are happening right now. But that creates more challenges. As I said, the closer we get to the clinic for these things, the more difficult it is to stand up and say everything's unproven and completely bogus. When I started working in this area even 5 years ago, I could stand up in front of an audience and say, it's all bogus, other than the few long-standing stem cell therapies that are out there. That's becoming more difficult, and I'm glad it's becoming more difficult. That means the science is moving forward. But it makes figuring out how to regulate this area, how to regulate and how to address this growing phenomenon of stem cell tourism all the more important. And I think as a community, we need to take greater care in how we talk about and represent and promote stem cell research more broadly. So again, thank you very much. It's an honor to have the opportunity to talk with you. Here are all the entities that I hype my work for, and I'd like to thank my amazing team. So thanks, guys. I think we might have time for questions.